It's time to sit back, relax, and listen to Conversations with Joan. Conversations with Joan will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. And now, here's your host, Joan Herman.
Welcome to Change Your Attitude, Change Your Life's Conversations with Joan. I'm Joan Herman. Thanks for tuning in. Infectious diseases are as varied as their symptoms, yet they have one thing in common, a devastating impact on society. As COVID-19 continues to spread around the world, many ask, how did this happen? Today's guest, Dr. Michael Greger, explains where viruses come from and how we can stop them. Dr. Greger is a founding member and fellow of the American College of Lifestyle Medicine, a physician, author, and speaker on nutrition, food safety, and public health issues. Dr. Greger is the author of the new ebook, How to Survive a Pandemic. Welcome, Dr. Greger. Thank you so much for joining us.
I'm so excited to be here again.
So, Doctor, with the coronavirus pandemic, just about everyone's attention has turned to viruses. Let's try to understand what is happening. First, how and why do viruses spread so efficiently?
Well, these particular pandemic viruses is because the people become infected and infectious before they start showing symptoms. Unlike SARS, the first deadly coronavirus outbreak of the century, in that case, you developed fever, cough before you became infectious, so you could stop people at airports, do some fever monitoring, and prevent the spread. But with this disease, as well as flu viruses, days before you start showing symptoms, you feel perfectly fine, but maybe exhaling virus with each breath. That's why there's been these social distancing measures to kind of lock down the populace to prevent as many chains of transmission as possible.
We hear about virus mutations. What does that mean?
Viruses, these particular viruses, both the flu virus and COVID-19, these pandemic viruses, have RNA as a genetic material, unlike DNA like us, which lack the kind of proofreading capacity. So every time a virus infects a cell and releases millions of new viruses, each one is just a little different, has these tiny mutations. That allows it to adapt to new hosts and even jump from one species to another. When we have a new virus jumping from animals for which we have no pre-existing immunity and everybody's susceptible, that's how a virus can spread rapidly around the world, and that's why it's difficult to kind of nail these viruses down in terms of vaccinations. The reason we need a flu vaccine every single year is because the flu virus mutates to be subtly different one year from the next, so we have to keep targeting it. We have yet to know whether the same will be the case with viruses, with the vaccines made to the coronavirus.
Do you think that the coronavirus has mutated and is in a different form than the one that originally came here?
Oh, absolutely. In fact, there are 10 different strains that have mutated around the world. This allows us, this kind of genetic fingerprinting allows us to track the spread of the virus. So for example, that's how we know that in New York, for example, it actually wasn't people arriving from China, but arriving from Europe that triggered the New York outbreak. And so you can see kind of in real time where this virus is spreading. We do not yet know whether or not these mutations of the virus actually have affected its ability to transmit or its ability to make people sick. But certainly it's within the realm of possibility that a viral strain will arise from the current virus that is even deadlier or even more easily transmissible, but that isn't necessarily the case. Just because a virus is mutating doesn't mean it's necessarily getting worse.
Well, that's what I was wondering, because now we're hearing that it's affecting children differently. And I was wondering if it could have been a mutation or just the fact that it's something we've noticed.
In fact, that's not a new phenomenon. So there were cases coming out of Italy months ago of the so-called Kawasaki disease, this multi-system inflammatory disorder. We're just seeing more and more cases as more and more children are being infected, but it's important to recognize that this remains an extremely rare phenomenon, and that the youth, unlike the influenza, that's one of the blessings of this virus versus a pandemic flu virus, is that children in general tend to be tend to be kind of less likely to fall ill, less likely to suffer a severe course. And it's really the age distribution is such that really those at high risk tend to be over age 65, and with these coexisting so-called comorbidity, such as heart disease, diabetes, obesity, hypertension. And so kids tend to be spared in this pandemic. And so if anyone's going back to school, I think we start with school children, though we need to keep, even if they don't themselves get sick, it's possible they could spread the virus to grandparents. And so anyone over the age of 65 or anyone in contact with those over the age of 65 needs to continue to be very cautious in terms of their coming in contact with potentially infected individuals.
Doctor, we hear so much about herd immunity, and there are people that believe that we should just all go out there and whomever gets sick, gets sick. Can you explain herd immunity and if that is an effective approach?
Well, I mean, that's the only way you stop a pandemic is herd immunity, and that's having a critical portion of the populace immune to the virus. And infection can only burn through a population if there are enough susceptible individuals for the virus kind of viral sparks to jump from one person to the next. Immune individuals who can't get or transmit the virus act as like fire breaks to slow the spread, like control rods in a nuclear reaction to break the chains of transmission. Now, ideally, this is accomplished through mass vaccination. Vaccines are a way to fight fire with fire, using the virus to fight the virus by generating the benefits of infection, immunity, without the risks, disease and death. But, it's humbling to realize, though, that, historically the average vaccine has taken more than a decade to develop, 11 years on average, with the average failure rate of 94%. And without a vaccine, herd immunity is really only achieved the hard way through mass infection. But look, you can't get the virus unless the virus can get to you. So I talk about in the book, all the common sense measures we can take to reduce our risk. We should only expect, herd immunity will happen when 50, 60, 70% of the population is infected. So even at the end of this pandemic, there's going to be a significant chunk of the population, like, a third or more, who never gets infected, never risks a severe course. And we want to do everything possible to be in that 30%, 30, 40%. And how can we do that? That's, respiratory, hand hygiene, all the things we've heard about.
So how would we know if we have immunity? I mean, I know testing's important. I actually had an antigen test done 10 days ago, and I've yet to get my results. So how are we able to do this and get the information that we need?
Well, yeah, unfortunately, unlike other countries around the world, we did not get our testing regimen up. We're still lagging behind other countries. It's important to take a step back and realize, look at, if you look at Australia, for example, they just hit a milestone. They had 100 fatalities. Out of the entire continent, 100 people have died, right? Now, they have, 10 times smaller population, but we have 1,000 times more deaths. We're, like 100,000 compared to their 100. In Taiwan, they have a population of about 23 million. They have suffered 7 deaths, less than 10 deaths. And why were these other countries able to control the disease where we're not? In fact, out of all the countries in the world, although Brazil may soon overtake us, we've had the most infections, the most deaths. And wait a second, what is going on? And part of that is really just a failure at a federal level to put in just these, the what has happened in other countries. Not only the lockdowns of the populace, the social distancing, but also the testing, the contact tracing, the necessary measures to prevent the spread of this virus. And even a day, a week, anything could dramatically reduce the number of people that become infected. And so,
right.
We were kind of late in the game, but this is no excuse not to play catch up, particularly if there's a fall wave on the way.
So all of this makes us feel completely out of control, as you can imagine. And We feel like there just isn't anything that we can do, but there are. You had mentioned common sense measures that can help us empower ourselves. So let's talk about that. What can we do to protect ourselves and to give ourselves the best fighting shot of staying healthy?
Well, it's important to realize the risk factors for COVID-19 severity and death: obesity, heart disease, hypertension, type 2 diabetes. Every single one of those can be controlled or even reversed with a healthy enough diet and lifestyle. So, this is the time. Take advantage of the time. If you are lucky enough to be able to have that extra time, you're not essential personnel out in the world risking infection, is to stay healthy, to take this time to get sufficient sleep, keep active, reduce stress, stay connected, albeit remotely, with friends and family, eating a healthy diet. This is, this should be our excuse. You always want to start a meditation practice, always wanted to start, exercise classes. This is the time, because how healthy you are can reduce the risk of not only getting infected in the first place, but then being in the in that rare 1 in 250 cases that unfortunately does not survive this illness.
So it's really getting to the root cause. Instead of putting so much focus on not getting this virus, it's really making ourselves healthy, building our immune system. That's our best weapon.
And one of the reasons why we have such a severe outbreak here in the U.S. is because excess body fat alone is a risk factor, even independent of diabetes. So those with severe obesity, which is like weighing more than 215 pounds at an average American's height of 5'6", 7 times the odds of ending up on a ventilator. Even just being overweight puts you at risk. Having a body mass index of 28 or more, that's about 175 pounds at the average height, appears to nearly 6 times the odds of suffering a severe COVID-19 course. In the United States, the average BMI exceeds 29. So even being skinnier than the average American still leaves you with so much excess body fat that can put you at risk. And this is because people with excess body fat have greater systemic inflammation, the fat covering the heart itself, something called hypoventilation syndrome, having a restriction of breathing caused by excessive fatty tissues in the upper body. But look, we've been months in quarantine. This is the time. Obesity is not something you have to have with ever. This is the time to control your blood pressure, control your body weight, and so then that could be the silver lining of this pandemic. You survive this pandemic, and then you are going to have healthier habits going forward in the future to protect yourself against chronic disease.
Doctor, where are these new viruses coming from? And is a pandemic like this going to be our new way of life? Will there be more and more potent viruses coming down the road?
Over the last few decades, hundreds of human pathogens have emerged at a rate unprecedented in human history. So wait a second, emerged from where? Mostly from animals. The AIDS virus is blamed on the butchering of primates and the bushmeat trade in Africa. Mad cow disease was because we turned cows into carnivores and cannibals. SARS and COVID-19 have been traced back to the exotic wild animal trade. But our last pandemic, swine flu in 2009, arose not from some backwater wet market in Asia, but was largely made in the USA on pig operations in the United States. Now, thankfully, swine flu only killed about 500,000 people, but the next time, we might not be so lucky.
Why was this so different?
Well, what made this one different is because the people are infectious within the incubation period, and so that is the period between which you're infected and start showing symptoms. And so, we were able to stop these other coronavirus outbreaks like SARS and MERS because you didn't become infected until you became infected. But in this case, with every breath you take, by day 3 or 4. After coming into an infectious contact, you're spreading this virus to those in your household, those out in the community that you come in close contact with. And so that's why, wait a second, if you don't know who's infected and who's not, because you can't tell by symptoms yet, who knows who's going to come down with symptoms the next day and have been infectious for 48 hours. Because you don't know who's infected, you have to lock down everybody and prevent as many social contacts as possible. And that has been effective in flattening the curve, preventing the overwhelming of our medical systems, and giving people a fighting chance to survive this pandemic. And so what we need to do now is, stick to the CDC reopening criteria, which unfortunately states are not doing, protecting the most vulnerable, this kind of layered social distancing, pumping the brakes to prevent the healthcare system from becoming overwhelmed until the virus can be stopped, either through vaccine or natural herd immunity.
So I'm in the New York, New Jersey area, and what making me a little bit nervous is it seems like we're going from 0 to 360. And I don't mean the government, I mean people. It's like some people, it's almost like letting the animals out of the zoo. I think some people are doing very reckless things, and that's what's making me nervous.
Yeah, I mean, there's real kind of black and white thinking going on right now. And, there's this kind of pandemic fatigue. People have been locked up. All of a sudden the weather starts coming, here in the Northeast, the weather's getting better, and people just, just getting kind of, getting crazy, locked inside. And so fine, go out. In fact, being outdoors, the risk of infection is very low because of the just natural ventilation, the dilution out in the air. So unless you're talking to someone, close within, 3-6 feet, you should, or someone coughs in your face. Being outdoors is really a low risk, scenario. It's really the confined indoor spaces where you can't escape people, you can't properly distance. So absolutely go outside, but that doesn't mean we have to, crowd ourselves together outside. Right, go to the beach, but just try to stay away from people because you don't know who's infected. And particularly for those with, again, these pre-existing conditions and those over the age 65 or anyone who has contact with anyone over age 65. So you can imagine a young person who's like, I'm at such low risk going out and having a beer with friends, but they don't know the price of that beer may be the death of their grandparents.
Dr. Greger's new ebook is How to Survive a Pandemic. If you'd like to get more information about Dr. Greger and his work, you can visit michaelgreger.org or nutritionfacts.org. And as always, you can visit our website, cyacyl.com, which stands for Change Your Attitude, Change Your Life. Dr. Greger, thank you so much for joining us.
Thank you. I'm so glad to be on.
This is Conversations with Joan. Until next time, thanks for tuning in.